Doctor, thanks for joining us today. 23.5 million people in America, nearly 8%, have type 2 diabetes. The question is, what is type 2 diabetes and why is it so prevalent?
Well, type 2 diabetes simply refers to a person that has too much sugar in their blood. A normal fasting blood sugar, for example, is 100. Fasting means blood sugar checked after not eating for 8 hours. So over 100 is abnormal. Over 126, we define that as diabetes. The reason it is so common is that we are overweight compared to what we used to be. 50 years ago, only 1 out of 10 people was obese, defined as being more than a third over their ideal body weight. Now that figure is like 1 out of 3. So 1 out of 3 people in the United States today is overweight, obese. 50 years ago, that was 1 out of 10. The incidence of diabetes has gone up in parallel to that. So it's basically a weight issue.
Why is it a weight issue? What is it about carrying extra weight that puts you at risk for type 2 diabetes?
Well, the extra weight seems to interfere with our body's ability to use insulin. People with type 2 diabetes actually make more insulin than someone without diabetes, but that excessive body fat causes something we call insulin resistance, which simply means that a normal amount of insulin does not lower blood sugar the way it should. Insulin is supposed to drive blood sugar into our body cells where it can be used as energy. I mean, blood sugar is a good thing. Too much of a good thing is diabetes. Excessive body weight somehow blocks the body's insulin from being able to do its job.
And you may have answered the question, but let's ask it. Who's at risk for developing type 2 diabetes?
Well, there's one factor I haven't mentioned. I've mentioned those who are overweight. The more overweight you are, the greater your risk. The other factor is heredity. If you have one parent with type 2 diabetes, you have a 50-50 chance of developing type 2 diabetes in your life if you're overweight. If you have 2 parents with type 2 diabetes, that's about an 80 to 90% risk if you are overweight. If you keep your weight normal, even having parents with diabetes will not increase your risk substantially. So having parents with diabetes and being overweight, that's the potent combination.
What are the symptoms of type 2 diabetes and how is it diagnosed?
Well, that's what makes diabetes so sneaky, is that early on there are no symptoms. The average person with type 2 diabetes has had it for between 5 and 10 years before it's recognized. And the reason for that is that there are no symptoms. A normal blood sugar fasting is 126 or less. With diabetes, you may have a sugar of 150, 160, 180. You'll feel perfectly normal. There's no symptom associated with that until your blood sugar is over 200. Then you'll develop frequent urination, get up at night to urinate, fatigue, dry mouth, wounds that don't heal. These classic symptoms of diabetes, which we think of as being, diagnostic, they actually occur after someone has had diabetes for several years.
What are some of the myths or misunderstandings that people have about diabetes?
Well, there are a lot of them. That's a good question. One of the biggest ones is that diabetes is caused by eating too much sugar, and that if you have diabetes, all you have to do is eliminate sugar and you're okay. Well, diabetes isn't caused by eating too much sugar. It's just caused by eating too much, period. You could eat the most healthy foods in the world, but if you eat too much so that you take in more calories than what you burn and become overweight, then you'll develop diabetes. So sugar is implicated because if you have diabetes and you eat sugar, that will make your blood sugar go up more quickly than if you eat protein. But sugar does not cause diabetes. It's just too much food. The other myth is that if a person has diabetes and if they exercise for 20 minutes, it'll cancel out their extra food they ate, their extra, their ice cream that they had for dessert or some other indulgence. Most people grossly overestimate the amount that exercise will cancel out food intake.
Why are the eyes and the feet so adversely affected by diabetes?
The feet that's probably the easier question. Two things that happen with diabetes. One is neuropathy, which means, fancy word meaning nerve damage. When that becomes advanced, the feet develop numbness. In fact, I have a patient that walked around all day with a nail in their boot, in the bottom of their foot, and they could not feel it because their feet were so numb. We could do surgery on that person's feet without anesthesia. So with numb feet, you have injuries that you won't take care of and won't recognize. Secondly, with diabetes, the blood supply is compromised. You develop accelerated atherosclerosis, the same process that clogs up the arteries in our heart, clogs up the arteries in our feet, so that there's not enough blood getting to our feet. So if we injure our feet, two things that are required to heal any wound is rest, so that that injury is not subjected to increasing stress. And secondly, there has to be a good blood supply to bring nutrients to help heal up that wound. So with diabetes, you don't feel pain, so you continue to walk on a wound, and you have a compromised blood supply, so you don't get the nutrients to that wound for it to heal. And so that's a prescription for disaster, which is why diabetes is responsible for most of the non-traumatic amputations in the United States today.
And what about eyes?
Eyes, we are not exactly sure. The first step of diabetic eye damage are these small little hemorrhages that occur in the course of small capillaries. The back of the eye has a network of very small blood vessels, and these seem to get weak for some reason in people with diabetes. We think it might have to do with the lack of oxygen caused by diabetes, thickening the wall of the blood vessel. So the short answer is we're not sure. We just know it does happen, and that yearly eye exams by an ophthalmologist can prevent vision loss, because that ophthalmologist, once they see those little aneurysms or those new blood vessels trying to form, can zap those with the laser and prevent vision loss.
What is the A1C blood test, and why is it important?
Well, the A1C blood test is as close to magic as we get in laboratory medicine. That simple test, which can be done with a finger stick, can tell us your average blood sugar for the past 3 months. There's two ways to get your average blood sugar for the past 3 months. We could have you test your blood 1 hour per day, 24 hours a day for 90 days, which would be hundreds of tests. Or we could do this one simple blood test, which will tell us the average blood sugar for the past 3 months. Now we know the A1C should be 7% or below, which corresponds to an average blood sugar of roughly 140 to 150.
What happens if a patient is diagnosed with type 2 diabetes and doesn't take it seriously?
Well, on average, they will shorten their life by 8 to 9 years. I mean, that's really the short answer. The thing that happens to shorten life is that it increases the risk for heart attack and stroke. Diabetes doubles to triples the risk for heart attack and stroke. Another complication other than the eyes and the kidneys and the feet. By taking good care of your diabetes, you're also going to be taking good care of two other important items, blood pressure and cholesterol, which are the most important factors in predicting and preventing heart attacks and strokes.
Thank you very much, Doctor.
You're very welcome.